Welcome back to Vetiverse, your guide to animal health and veterinary awareness. Today we're talking about one of the most expensive and painful diseases in dairy animals, mastitis. Your cow or goat may look fine today, but one bad milking session, one dirty towel, or one infected quarter, and tomorrow her milk might be full of clots. Mastitis doesn't wait. It strikes fast, hurts production, and can even destroy the udder permanently. Let's break it down from cause to prevention and understand how to protect your herd from this silent enemy. Etiology. Mastitis means inflammation of the udder, usually caused by bacteria that enter through the teat canal. The main culprits are Staphylococcus aureus, causes long-term and fibrotic mastitis. Streptococcus agalactiae, spreads quickly between animals. E. coli, environmental, causes sudden severe inflammation. There are also occasional infections from Corynebacterium, Mycoplasma, or even fungi after long antibiotic use. Think of it this way: contagious bacteria spread during milking, while environmental ones come from mud, manure, and dirty bedding. Both destroy milk and udder tissue, just through different doors. Distribution. Mastitis is found everywhere dairy animals are milked, from high-tech farms to backyard cows. In Pakistan, it's most common in cows and buffaloes, especially during hot, humid months when bacteria multiply fast. Sheep and goats also suffer mastitis, usually around kidding or lambing season. Transmission. The disease spreads in two main ways: contagious and environmental. Contagious transmission during milking through dirty hands, towels, or machines. One infected udder can contaminate the next 10 animals. Environmental transmission from wet, dirty bedding, feed troughs, or splashes of mud. Insects and flies can also carry bacteria from one teat to another. Every drop of infected milk is loaded with bacteria. That's why hygiene during milking is non-negotiable. Pathogenesis. Here's what happens inside the udder. The bacteria enter through the teat canal, settle in the milk ducts, and begin multiplying. The animal's immune system sends white blood cells to fight back, but this battle causes heat, pain, and swelling. When bacteria release toxins, milk quality collapses. It becomes clotted, watery, or blood-stained. If infection continues or treatment is delayed, the udder starts replacing healthy tissue with fibrous scar tissue. This is called fibrotic or chronic mastitis. The udder becomes hard, the quarter stops giving milk, and the damage is permanent. Clinical signs. Let's look at what you'll see in the field. In acute mastitis, swelling, heat, and pain in one or more quarters. The animal resists milking. Milk looks abnormal, clotted, flaky, or watery. Fever, depression, and loss of appetite in severe cases. In chronic or fibrotic mastitis, the udder feels hard and lumpy. Milk production drops sharply. No fever, but the quarter becomes permanently damaged. In some cases, repeated infections flare up again and again. In goats and sheep, signs can be subtle: a slightly swollen udder, thick milk, or lambs refusing to suckle. Don't ignore these. They're early warnings. Diagnosis and differential diagnosis. Mastitis is diagnosed by clinical exam and lab testing. California Mastitis Test, CMT, quickly detects high somatic cell count in milk. Bacteriological culture identifies the pathogen. Udder palpation helps detect fibrosis or hard lumps. Differential diagnosis includes udder edema in pregnant animals, non-infectious, trauma or injury, abscesses or tumors, localized, not diffuse swelling subclinical mastitis, no visible signs, but poor milk quality. Early detection saves both milk and money. Treatment. There's no single miracle drug. Treatment depends on the type and stage. For acute mastitis, use intramammary antibiotic infusions as prescribed by a vet. Give anti-inflammatory and pain relief to reduce swelling. Milk out infected quarters frequently to flush bacteria. Provide soft feed, clean water, and dry bedding. For chronic or fibrotic mastitis, antibiotics rarely reverse damage. Sometimes culling the affected animal or drying off the quarter is the only solution. Focus on preventing spread to healthy animals. Prevention. Mastitis control is all about management, not medicine. Milking hygiene. Wash hands and teats before and after milking. Use a separate towel per animal. Disinfect teat dip after milking. Housing. Keep bedding clean and dry. Control flies and insects. Avoid overcrowding. Milking order. Milk healthy animals first, infected ones last. Regular udder checks. Detect early signs before fibrosis begins. Vaccination. In regions where vaccines are available, like against Staph aureus or Strep agalactiae, vaccinate high-risk animals. Remember, every clean milking saves liters of milk and months of recovery. That's all from Mastitis.